Morning, Tri-Cities. Today is Monday at 11. It's a very special Coffee with Karl. Thanks for joining us today. Today, our guest is someone we've had on many times before, and we're happy to welcome back Dr. Amy Person to have a conversation about the pandemic that we're in. So Dr. Person, thanks for your time this morning on short notice. We really appreciate you joining us.
Well, thanks. I'm always happy to be back here having a conversation.
You bet. And since it's a special one, we can always talk about our mugs. I brought my Tri-Cities mug because that's what we're here to talk about is, you know, our community that we're in. How can we support our neighbors and businesses and friends and stay healthy and get through this pandemic and come out of it as well as we can. So I don't know, Dr. Person, if you brought a mug today or if you have a coffee or mug story.
I got my mug. This is my PNWU mug, and I've got this one because one of the things I've enjoyed in public health is that the medical schools, both PNWU and WSU, are now having students rotate through the health district periodically. So I think the opportunity to engage our future physicians in public health is key, and I think it's shout out to all of them trying to navigate being in medical school during a pandemic. I think is both a once in a life experience that has a lot of good and a lot of bad, I think, associated with it. So challenge for them as it is for all of us.
You bet. Well, that is awesome. I think we were all excited, you know, when WSU was able to start the medical school program. And I think part of the basis for that was obviously getting more doctors out into especially rural parts of the state and the Northwest. So that's awesome. And it's actually a good segue into the first thing that we want to talk about is let's start off with just talking about very generally the role of public health. You know, maybe you can give us an overview of, you know, normally what does the health district do? And then in a pandemic, what's the role of the health district? And maybe we'll start off with that and then get into some of our questions here.
Sure, absolutely. You know, public health, we're like that thing that honestly people tend not to think about unless they're not happy with it. You know, in a global sense, if we look at the United States, majority of the increase in our life expectancy since the 1900s is due to changes in advances in public health, primarily maternal child health, immunizations, safe food and water. So again, public health is the greatest thing that's working that nobody knows about. So outside of a pandemic, what we're doing in public health, we've got two major sides. One of them is probably the more regulatory side, so what we do around food safety and water safety, tracking all communicable diseases that people can transmit to one another. We've also got our piece that's really more about helping build communities, particularly people in communities that may be struggling. So our work in maternal child health, our nurse family partnership program, work we do with other community groups to try to support people. So the health officer as a role is not just a job description, it's actually something that has existed as part of Washington state law since, I think, within 5 years of when Washington was founded as a state. It was recognized that there are instances where you need somebody that can speak from expertise about health and about science to advise our elected officials. So this isn't a new position. Again, it has been part of Washington state law for centuries, honestly. And it's a role that really relates to protecting the health of communities. So it's not an all-encompassing power. It is a power to use my knowledge and expertise in conjunction and in collaboration with the knowledge and expertise at the state level, at the federal level, and then also local medical health and science experts to really make those decisions.
Well, that's great. And I think that's a great framework to really put the work that you and everybody at the health district does is, you know, focused on health and keeping people safe in our community, and such great examples, right? Like we all got vaccinations as a kid, you know, and obviously the role of vaccinations in eradicating smallpox and some of these other diseases is great. And I always think about it. And your point about clean water is a good one, in that people's knowledge of the health district before was if they owned a restaurant, they knew they were going to get inspected by the health district. And then if you're going to build a house out in the county, you're going to have to get, you know, somebody come out and look at your soil to make sure there's a perk test that the, you know, your septic tank is going to work right or something. So, I mean, those are a small part of what you do, but I think in a pandemic, that's what we're all learning, is that obviously the health district now has more visibility, because really pandemics were maybe part of why health districts or public health was formed in the first place. And you talk a little bit about the health district's role and maybe your role as the health officer in that pandemic, and the work that the health district does working in partnership with all the other agencies and individuals you just talked about.
Sure, and it's, yeah, I think this is also one of these things that when we try to think about the role of a health district, you know, if we were going to plot it on a diagram, it would have lines going in 16 different directions, which I think has been a challenge for the, you know, the community to try to understand, because we can look at it at different levels. If we look at restrictions around, say, what businesses and things have been able to do, those have been orders that have come from the Department of Health and from the governors. You know, as the local health, what we do is we help to people here to understand the laws and the rules that have come from the state. We can't change those, but we can help people to navigate them. We can also bring local voices back to the state when there are opportunities to talk about that. And we saw that when, through our months of negotiating and kind of incrementally being able to add services, that was our working with the community here to understand, you know, what do people need and what do people feel like can be safely done, and then to take that information to the State Department of Health to try to, again, allow more things to occur here. Then we can also look at our role in what's going on with the schools, because I know that's a very hot topic and, you know, has been an ongoing challenge as well. And in that one, local public health does have a little more of a guiding role than the state did. So the state issued guidance, but the guidance clearly indicates that it is the job of local public health to advise schools and to guide schools about the public health impacts of their decisions to be virtual or to be in person. So how is disease in the community going to affect schools opening? What do schools need to consider? But none of these are decisions that any one person is making in a vacuum. So with the schools, we are working with our school superintendents to help navigate those challenges, because no matter what public health may advise or not advise about those risks, the schools also have to look at what can we do? You know, what logistically can they do based on their staffing and their resources?
No, and that's a great answer. And I think that brings us to the next point of conversation, is the governor's, you know, press conference yesterday. And I'll just say that I was listening to it, you know, trying to learn, you know, where we were going with this new statewide order. And I heard the governor say, and exactly what you just explained with in regards to local school districts, is that the state isn't going to make a mandatory or a statewide statement or restriction on school districts, that those are local decisions. And as you talk about that, that is a collaborative process between you and the health district and those school boards. And coincidentally, on Friday, we will have all 3 local superintendents on to talk about that. And so for our audience out there, if you, we're getting some K-12 questions, and we'll talk to Dr. Person about those, but we'll save some of them for that discussion on Friday too, so we can have, you know, both sides of the equation for sure. Because I'll just say, I think we've never been through a pandemic before, and I think so many times as people, just, you know, citizens, we expect that somebody has all the answers. And I think that, Dr. Person, you've been really clear when we've talked about it before, that this is new. Number one, we haven't had a pandemic in 100 years. And number two, it's literally a novel or a new virus that we're learning sometimes daily. And so sometimes, because we're learning new things, that guidance is going to change based on what we learn and based on science. And so it's hard to, you know, have this expectation that we know everything about it, because we really don't know it in this case. And that's got to be a challenge for you and your team, to try to help people understand those things and issue that guidance.
Oh, absolutely. You know, the standard we have in public health in terms of being, you know, evidence-based and data-driven has historically, sometimes that means that we maybe don't move as fast as people would like to see, right? If we want to make sure our data is the best and of the highest quality, we're reviewing it and vetting it, which is why typically when you get information, it's not real time, right? It's from a year or even more past that. But in a pandemic, we don't have that luxury, right? You know, we could wait till we get all the, you know, look at all the numbers and analyze them, and then come back with what we should have done some point next year, but that's not going to help. So that's really what we're challenged with now, is using information real time, which means that what we based on the information we had available in March is going to be different based on the information we have that includes March through June and now March through November. So those recommendations do change. And I think it has been hard, particularly with the overlay of kind of the whole political unrest that's existed everywhere, for people to be able to trust change, for them to not see change as either a lack of transparency, oh, you were hiding something, or a lack of, well, you don't know what you're talking about, right? And so that
Sure.
you know, that's the thing, you know, either we don't know what we're talking about, or we're changing things to suit our needs.
Yeah, and that's a good point. And we won't get into it, but, you know, it's similar to vaccinations. You talked about the role of public health in vaccinations, and some people don't agree with science that shows that vaccinations actually did things like eradicate smallpox and stuff. And so that we don't want to get into that, but I get what you're saying, because we all see those, you know, whether it's social media or something, where there's always that ongoing discussion. And I'll just say myself personally, you know, and now we're going through it with our kids who are distance learning, you know, the scientific method, right? The scientific method's pretty proven. It's been out there for hundreds of years, and it's a process that we, you know, understand science. And that's what I believe in. And I know that's what you're following at the health district. And I think that's the best thing that we can do, for sure. Well, let's talk a little bit about just how are we doing, you know, on the metrics. And obviously we watched that before, and we know that there's been an increase in infections, but can you give us kind of an update on how are Benton and Franklin County doing as far as, you know, some of the metrics that the health district tracks?
Sure. So over the last, we have seen a significant increase in our numbers of cases and our case rates, more so in Benton County, where we are headed to surpass the peak that we had in July. So to put our numbers of cases in perspective, I can do looked at this show in the last month, we have seen 20% of our total cases occurring. So in an eighth of the time, a fifth of the cases have occurred. In our last 2 weeks, it's been 13%. So 1 out of 7 of our cases has occurred in the last 2 weeks. So it has been a huge influx. We're also starting to see an increase in the numbers of people in the hospital with. Locally, we haven't been taxed quite to the extent that they have in some of the bigger metropolitan areas on the west side or on Spokane, in Spokane. But we have heard our hospital leaders talking about it's not just the bed availability. The things that they watch with concern is staffing, staff burnout. Reza Khalil from Cadillac, I think, describes it very beautifully. He talks about, if you ask someone to hold a 5-pound bag of flour, with their arm extended, they say, sure, I can do that. And they can do it for a few minutes. And now, but when you say, okay, now you got to do it for 9 months, that becomes a bigger challenge, particularly the staffing with the ICUs, because again, with a global pandemic, most of the time when hospitals, if they need to temporarily replace staff, they're going to use locum tenens, they're going to use, traveling ICU staff. Well, everybody needs those traveling staff. So those kind of availabilities aren't there. When hospitals in Seattle or Spokane get overwhelmed, that affects our ability if we need to transfer somebody for a higher level of care. And I think on the converse side, as hospitals around the state get filled, they'll be looking to other regions, which includes our area, if they do need to transfer some of those. So I think when people say, well, our hospitals are fine now, that's a little bit of a dangerous place to go to, because if we wait until our hospitals are not fine, we don't have any place to go. When we get to that point, there isn't, we don't have a safety valve because everybody else is going to be in that position.
Yeah. No, that's a great point. We just had a question that is kind of the next question we're going to talk about, but on the increase, and I think that's a good way to look at it, that, a fifth of all the cases, or is that what you said?
A fifth of all the cases have occurred in the last month. Yeah, and actually, we look at Benton County alone, a quarter of all the cases have occurred in the last month.
Wow. But we had a question about contact tracing, and I think that this, maybe then we can move into the governor's new order yesterday. But what are we seeing in contact tracing? How's it going? And do you have all the resources that you need to be effective, in contact tracing to try to really address how are people getting sick? Where's this uptick coming from?
Well, and that's a great question. And we actually, in terms of staffing, at this point anyway, we are really very well positioned. And that's, thanks to having some additional funding from other places that has allowed us to bring in temporary staff. And we're seeing the impact of that locally, in that we are more successful in getting a hold of people. And when we're talking with them, our contact tracers, if they're letting people know they've potentially been exposed. And what we're seeing more and more now is that people who know that are going to get tested to find out whether or not they're positive. And that's really what we want to see, right? Is that people who are positive are people who are aware they've been exposed, so that they've been in quarantine, so that they're not exposing others. One of the big challenges, though, that we still face is that people are oftentimes afraid or reluctant to tell contact tracers who their contacts have been, and where they may have been exposed or places they may have gone when they're infectious. And I think too, this is the challenge, right, of trying to balance wanting people to take certain precautions when they are infectious, and because many of those precautions include not going to work if you're positive. If you don't have a way to sustain yourself or your family without your being at work, that's a huge barrier. So for us, bringing in additional support with our case management so that we get a hold of people, or people let us know if they need support to maintain isolation or quarantine, has been a big piece of that. But that's an area where we see challenge.
Yeah, no, that's a good point. We talked about it before. I think when we first got into this, there's industries that were affected, and there was that same hesitation to even, in this case, it's contact tracing, but even just kind of have a conversation with the government, because there was a concern about, being shut down, an operation shut down, or something like that. And I think, again, these are things that we don't see coming until we get into a pandemic situation. But on the contact tracing, do you think there's also, and I don't know, I'm just guessing, but you get sick, and do you think that individually people then unfortunately realize that, oh, maybe I shouldn't have gone to that gathering. Oh, maybe I should have worn a mask. Maybe I shouldn't have done these things. Do you think there's maybe a little bit of delayed guilt and realization, like, oh boy, I'm really sick with this new thing that scares me, but I feel guilty because I knew I shouldn't have done this thing? Do you think there's some of that too?
I'm sure there is. I think there's some of that. And then, if we're looking at kind of our increase in cases, like where we're seeing more of them, I think also speaks to the fact that much as we try to really take people about, a virus is a virus. So whether you get it or don't get it, it isn't a sign that you're, not an upstanding citizen or not a good person.
Sure.
But the virus doesn't care, right? If you're susceptible, you're going to get it. But what we're seeing more of now is that people are getting, infected when they're out to dinner with friends, or, they have a party, or even, just a small gathering. It's the 5 people that's allowed, but because it's their friends and because people feel safe with their friends, they equate that to say, if I'm safe with them, it means I'm safe from the virus. And so that's where we're seeing the guard let down. And that's why we talked about people about having that COVID chat. Because the stories we also hear are that people are assuming, if I'm going out to dinner with my friends, that none of them are going to show up if they're sick. And that's not always the case.
Yeah.
Other people honestly might be assuming that I'm not that sick and we're all young, so COVID's not going to be a big deal. So it won't really be a big deal if other people get it. So I think, setting those boundaries and those expectations ahead of time will help. But again, how can we do that just to say, this is really individuals just talking about what they're comfortable with. They're not passing judgment on somebody else if they don't want to do that. They're just saying, if you feel that way, then I'm going to be more comfortable not being, at an in-person gathering with you. But yeah, we need to get used to that.
Yeah. Do you think, and we talked about it's a new virus, we don't know, we're learning all the time, but do you think there's also this psychological effect for all of us as individuals? I think generally people know, like, if I'm sick, and I have the COVID, I don't want to give it to somebody else, but because they can be asymptomatic, and is there like this psychology just in groups of people too that says, well, that's not going to happen to me, or or, I just have allergies and I don't have COVID. Is there a dynamic there that might affect what you're describing too? I mean, I don't know if there's any research or any science behind it, but it seems like, we all know what it's like to be sick. And if you're asymptomatic and there's this new virus, is that kind of part of the, thought process or the challenge in trying to get people to, not gather in small groups and to make sure they follow all the safety guidelines?
Oh, absolutely. Anytime we're looking at how people interpret risk, when you have something that's new, people try to figure out how they can kind of fit it into their understanding of things. And so it's human nature to try to look at, what makes me different from people who've been infected so that I can say, okay, I'm not going to have to worry about it then. And again, that's human nature, right? We don't want to think of ourselves as somebody that something bad is going to happen to.
Yeah, no, I think it's human nature to a certain degree that we don't want to think it's going to happen to us. And probably if it does happen to us, then maybe you have some remorse when you look back and say, oh, I shouldn't have done that. Or maybe that. We did have another question that came up. Has the health district identified any super spreader events in Tri-Cities? Like, has there been any, bigger events that are, cause more outbreaks, or has it been more these smaller gatherings that you're talking about, Dr. Person?
We haven't identified any larger super spreader events. But I'll have to, say in all honesty that I don't know whether that's that there haven't been any or that people are not identifying those. Department of Health looked at contact tracing data for some of the counties in central Washington when they were doing contact tracing over the summer. And in Benton-Franklin counties, they identified that 3 out of 4 people said they had 0 close contacts, which we know isn't possible, because if everybody who was infected was only infecting, 0.25 people, this disease would have petered out by the end of summer. So again, people just aren't sharing that information with us. And that, I think, is the challenge. There's this idea of super spreader events, and then there's also this idea that there are likely just individuals that may be more likely to spread. But we don't know the characteristics of those individuals. There are situations we know do make it more likely to spread, or more likely for an event to be a super spreading event. And that's going to be if you are in a closed place with poor ventilation, if you're crowded situation, and if you're close to people. And that's, I think, part of what was driving the governor's decision and some of those concerns, because we're moving into winter months. And so the more that people are indoors, the more that they are around the table, having dinner, or again, look at Thanksgiving, I think is going to be a perfect example to me of where we could see a lot of that super spreading events, right? Everybody crammed around the table. I mean, I remember Thanksgiving, when I was a kid, never enough chairs. So we were all, sitting on top of one another inside, windows closed, because I'm from the Midwest. So it was snowing outside and seeing a lot of people we hadn't seen before. So we were spending a lot of time together. So yeah, that upcoming holiday, I think, is a scary prospect for us in public health.
Yeah, for sure. And I think that it's a future discussion, but it makes you think about, like, as the vaccine comes out and as we go through a public health process, just like we did the flu 100 years ago, right? Like, because we all know what it was like before COVID, at some point in time, we will get back to that. We will be able to do all those things because we'll have a vaccine, because these things will happen that will collectively protect the public health against COVID in the future. But it's just going to be really interesting, I think, in that we've all now been through this pandemic, and we have so much more awareness of things like social distancing, of, you know, how far droplets or aerosol might spread, and washing our hands and hand sanitizing, and even wearing masks, how collectively we all might be hesitant to go back into those situations, even with the vaccine, even with these safeguards in place. It's going to be very interesting to see. So you mentioned the governor's order. Can you give us an overview of what the governor said? And I just want to say that I think from TRIDEC, I just was on a call with Lori and Michael from, you know, the Regional Chamber of Commerce and Visit Tri-Cities, and we just were talking about what can we do to help these businesses, because we know that there are going to be a lot of businesses locally that are going to be impacted by this announcement. But can you give us an overview of what this new announcement covers, Dr. Person?
Sure. So, you know, the governor's announcement, again, recognizing that rates are exploding across the state, and that what occurs whenever we have people gathered indoors is where there are going to be risks. So that's where many of those limitations were made, you know, including the restaurants now needing to go back to, you know, outdoor or to-go orders, limiting gatherings outside and eliminating gatherings inside, particularly social ones, limiting retail. Again, what he was trying to look at is not taking everything away, but trying to figure out how can we make it less likely that if you're infected, you're going to be able to infect a lot of others. I think with all this too, when we're thinking as individuals, there are so many opportunities for all of us as individuals to make those choices and decisions that are going to help our businesses get back sooner, right? So if everybody collectively right now, we put our masks on, we maintained our distance, we didn't go to work sick. If we all did that, we could get our rates to turn around in 2 weeks. I'm going to say it'll take at least 2 weeks, right? Because everybody who's been infected over the last 2 weeks may or may not get sick in this upcoming 2 weeks, and we can't control that. But we can control from this point on everybody who may get infected. So if people take this as that challenge to, yeah, let's really step up. If we turn things around, we could turn around how quickly we could go back to opening things up. So we do have some control over this, but we need everybody, you know, again, it can't just be the same ones that have always been wearing the mask, you know, and doing those things. We need everybody doing all of these things all of the time in order to turn this around.
Yeah, no, that's a great point. And I think, you know, we've talked about it before, and I think with this latest announcement, it's even more true now. And that is that, you know, I'm a new Tri-Citian, but the Tri-Cities has a very long history going back to World War II and beyond of the community coming together to overcome, you know, great challenges. The whole B reactor in Manhattan project going back to World War II was this amazing example of you know, what our community can come together and do. And I think the thing that we all have to think about in all those stories about resiliency and, you know, how we can make it through and how we can survive is that, you know, freedom doesn't come without responsibility. And it's ironic because this afternoon I'm going to talk on the phone to my high school history teacher. And I can remember being in high school that he made that point really clearly, right? Like, as Americans, we have these freedoms, but they come with responsibilities. And you just made a great point, Dr. Person, I wanted to go back to, and that is that we can change this. If we make that local decision to do everything that you've recommended, all the social distancing, and look at those gatherings of friends and family, and we don't know who's sick. So it's going to be a challenge. You're going to have to change some things, but if we do it together, if we come together and do it, then we can change the course of this pandemic, and we can change the course of how our businesses are going to be affected. And that there are those things. And we had a guest on that gave a great analogy, and it was, the weather and an umbrella. Like, the weather is a very complex thing, and it's hard to forecast. Pandemics are very complex things, and we've never been through them. The difference is in weather that when you go outside and you put an umbrella up, you're just protecting yourself. You're not going to change the course of the weather. But if we do these things that you just recommended, if we mask up, if we look at our small groups and just make sure that we're safe and that we're either wearing masks or we're waiting for a while to do that, or, all the things that you've come up with and give us great guidance on, we can have a course on this. Like, we don't have to be waiting for it to affect us. We can affect it if we do these things together. And I think I just wanted to really go back on that because it's a really important point, and I appreciate you making it. Let's go. So we're getting questions about the school district. Let's talk. And you talked a little bit about the discussion between the school district. So I'll try to compress some of these questions and some commonalities. And then for everybody that's asking questions about education, I will say that we will have the superintendents on Friday, and so we'll save these questions. So if the question's more relevant to the superintendents, then we'll ask it on Friday instead of Dr. Person. But we had a question about published state guidelines and reopening schools. Can you talk about what the state guidelines are, and then how do those come into, Dr. Person, what you and the health district might come up with local guidelines, and then that conversation with the school districts? How does that all work?
Sure. And this too, I think, is a great example of how things have shifted over time. So when the state originally published their guidelines back in early August, there wasn't a lot of information anywhere about, how to successfully open schools in a COVID-19 pandemic, right? So they based the information on what had occurred in Europe and other parts of the world. And so they set a metric, the 75 cases per 100,000 for 14 days, which I think almost everybody has committed to memory. And that's where a lot of that focus has been on. However, if you read all of the state guidance, what it says is decisions about opening schools need to be based on several things. They need to be based on community disease activity. They need to be based on other impacts of disease in the community, including hospitalizations, testing positivity. They need to be based on the impact of education or school on children. So what's the effect if kids can't be in school? Also needs to be based on, does the school have the capacity and resources to have all of the infection control and safety measures in place? Is there sufficient public health capacity to do contact tracing, to do wide-scale testing? So it was a whole series of those. So it's always been a local decision. I think there's been a lot of focus, again, just on that 75, and because our numbers have been higher than 75, confusion or a lack of understanding about why the local decision was different. And that was based on the fact that as September and October rolled around, we did have more information about what happens when you open schools in a COVID-19 pandemic. And majority of that information said that if schools can implement all of the safety protocols, there are two things that occur. One, they don't contribute significantly to disease in the community. And two, you don't see outbreaks occurring in those schools. And I'll also say that we are going to be seeing the state changing their guidance to increase that 75 number, because they've also recognized that schools actually can open safely even when disease activity is higher. We know it works better in elementary school age because younger kids are less likely to transmit, but it can also work in those higher grades. I will say that as with everything in COVID-19, we're continuing reevaluating the decisions, and there are going to be some new conversations based on the governor's order, because again, if we're looking at an explosion of disease activity that is causing us to need to restrict other things, we also have to look to see where schools fit into that. The governor was pretty clear that there's not an expectation that schools that are open need to close, but I think this will probably shift the conversation about what are we going to do about schools with grades that aren't already open. So I think we will see a different conversation about this, and that'll be a conversation that the schools and I will have on this, as we have had on every single change that's occurred with COVID-19 since the beginning of September.
That was great. You actually you just answered two questions that we got while we were chatting. So what I heard you say is that basically based on the governor's new order and then the increase in cases, that there will be ongoing conversations with the school districts, and because of winter and being in close spaces, that again, just like COVID, these things may change. We did have a question about on the health district dashboard, it appears to indicate a sharp increase in elementary age children in Benton County, and like Kennewick, I know grade school kids are back in school. So have you seen that, Dr. Person? And is there attribution to schools being open, or are we seeing that increase in younger school age children?
In Benton County, we're seeing increases across the board. So we do know we've seen a number of cases, both in students and staff in our school districts that are open, that are showing up at school that have been infected. What we're not seeing is that people are being infected because they were at school. So the increase we're seeing in school-age children, we would have seen whether or not schools were open, because the kids are getting infected outside of school. They're getting infected when they went to the pumpkin patch. They're getting infected from their trick-or-treating, from their birthday party, from their elite sports, there are as many cases as we're seeing. I think there are that many examples of it. So the increase in school-age children is not because they've been in school. If that were the case, we have identified multiple outbreaks inside of the schools, and that we haven't seen.
That's great. Thank you. We did have one about, do you feel Tri-City retailers are doing a good job of enforcing, and enforcing is in quote, and as we've talked about before, that there isn't really an enforcement mechanism when it comes to retailers or any business wearing masks and reduced occupancy levels. But I guess kind of the nature of the same question, are you seeing any outbreaks that are attributed to or traced to somebody going shopping or something like that? Or do you feel like retailers are doing a good job of following the guidelines and staying safe?
Where we're tending to see outbreaks in the business community, and when we say outbreak, we mean 2 or more cases within 14 days that are attributed to that location. So, not the hundreds that we saw with Tyson, but the smaller ones. So we are seeing multiple of those. Vast majority of them are not related to, how do I say it, like employee customer interactions. They're related more to employee interactions, right? So again, this becomes our challenge. So we may have a business where staff may know each other outside of the business. So they all have a potluck, they all have a Halloween party, and then they all go, they go to work. And so then others of them may get infected at work. But our business environments really have been doing well because they have guidance and they have regulations that they need to follow. Again, our bigger challenge is that people who are employees are also people who have lives outside of the business world. And that's where we're seeing the lack of, I'll say, regulation, right? So an employee who's very good about masking inside of their work site may not necessarily be that good at masking when they go out to dinner with their, even if not a coworker, if they go out to dinner with their friend. And so they are bringing cases back into businesses. And that's the challenge, right? And that's unfortunately where we're seeing businesses being affected by the level of disease activity, even if it's not because of what they're doing or not doing. So again, if individuals, when they're acting not just in their role as employee, but in their role as a resident of Benton-Franklin counties, can pay attention to what they're doing, they're going to help the businesses.
That's a great point. We've just within the last week, we've had discussions with many larger employers, and they're saying the same thing. And they know that they're not seeing a spread when they're in their place of employment. It's what they're doing when they're not there. And that, from an employer point of view, they don't have any control over that. They can make sure they follow the guidelines and everything's safe, but they don't have any control on what people do once they leave work. And I think that's the message we're really trying to get out today, is that we each take a look at our personal responsibilities, and we take these things seriously, because we can have an effect. We can change the curve of it. And, we can help our small businesses, we can help our retailers and our restaurants and our gyms that we know are going to be affected by this recent governor's orders. It's our responsibility to help them out and to, help them not be impacted, along with our healthcare workers. I mean, Riza's example of the 5-pound sack of flour is a great one. That can't imagine what it's like being on the front line, your staff at the health district as well, to just be constantly on edge, constantly be dealing with this pandemic. And, we all need a break, and we can do that by helping ourselves out and following the guidelines. And I think that's the message we really wanted to make sure we got out today. We had a question relating to K-12 contact tracing. So can you cover that? I guess when it's maybe a school-aged child, do you go to the parents on the contact tracing, or how does that work for the younger students, Dr. Person?
We go at it in a couple different ways. So one, from the health district standpoint, so we talk to, or attempt to talk to, everybody who is a case. Obviously, if it's a minor or a child, we're talking to their parents. With schools, we are also in conversation with the schools. So we're asking for their help as well, because if someone's been in a classroom, if we're trying to figure out if there are close contacts in the classroom, the child or even the family, I mean, they know what class they're in, but they may not know, the names of the other kids or who else in that classroom might have been at risk. So that's where the schools are helping us out as well. And we're sharing that information as we are allowed to do under both HIPAA and FERPA. So again, following all of those appropriate guidelines.
You bet. We had a question about, does the length of school classes matter? So I know, and I think that the like Kennewick School District, where the elementary students have returned to class, I believe that they're doing like an A and B schedule. So the kids are probably going like 2 days and then, 2 or 3 days of asynchronous. But does the length that they're in the school matter as far as contact tracing? And obviously if they're on the A and B schedule, they're doing it so they can have more distance in between each desk in classes. But yeah, does the length of the school day or the class matter?
What matters the most is being able to maintain that distance from one another. So I won't say that length of time has no effect, but if that distance can be maintained, then we don't see spread. And that's been the example in other countries and in other parts of the United States as well, is that it isn't as much an issue of whether kids are in school all day or half day or how we stagger those. What matters the most is, are they able to maintain physical distance from one another? So do we have enough of those things in place to do that?
We had a question too about any possible changes that you're considering for recommendations for special education services. And I know that the districts in their decisions that special education students or students with IEPs kind of have some different guidelines than your standard student. Can you talk a little bit about some of those differences? And I think it relates to some of the state educational standards and requirements for if you have an individual education plan. But from a health point of view, can you give any talk about that, Dr. Person?
Sure. So there's a couple things from that. One is that for some of the kids that require some additional educational support for various reasons, they may not necessarily, the child may not be able to follow all of the infection control kind of parameters, which is why there are additional safety measures in terms of the level of protection that teachers in those classrooms would use, because again, you may have kids that can't wear a mask because of their underlying health condition. As the governor made clear in his announcement yesterday, there's not an expectation that schools that are currently in operation, classes that are currently in operation, whether it's special education, elementary, or even secondary for some of our smaller school districts, are going to be expected to change what they're doing or to shut down because of those restrictions. And the reason for that is because they have been able to manage successfully. So many of the small group instructions, those have been going on even longer than we've had our elementary kids back. So changes in those would really be based on changes in available staffing. So again, the school may have to change if enough of the teachers that teach those classes perhaps get infected again from their other activities. If they have those kind of gaps and there aren't sufficient substitutes, there's not enough, qualified personnel, then that may end up changing.
No, that's a great point. My oldest sister is a third grade teacher in Pullman, and we do a family Zoom call every week. And she was just talking about some of the challenges. She's in her 60s now. And so she's actually at a higher risk age group. And so the district's working with her so that she can focus more on the remote learning, the asynchronous, with kids and as they bring kids back. And so, just even within our family, we had that example of schools it's tough. I think that's the other thing we're coming to. This is really new. It's really tough. There aren't easy answers. There's hard answers. And I think that we all got to give a little bit to collectively bring the community through it. We had one more question, and then we'll kind of wrap up, Dr. Person. But does the health district, or how does the health district provide guidance to Department of Energy and the Hanford site? Do you guys have, do you pass guidance along, or how does that work to help DOE and the Hanford site set their safety guidance?
Yeah, so we work with them, I think, on a number of levels. So there are participants from the area that are on our local decision maker calls. We also have various agreements that have been in place to work with doing contact tracing, using their occupational health. And then, as we do with all of the businesses in the area, if they have cases, we're working with them to help them kind of see through that process. I think anything with Department of Energy in Hanford, there's also that added layer of, they also, as federal agencies, have to follow sets of guidelines around those. So sometimes what we're doing is helping to, again, navigate what the state requires, what the federal requirements are, what local requirements may be. So again, really, it's a share, all of us sharing the information that we have, the expertise that we have. But yeah, it's not so much who's ordering who to do what, but really how can we all share the information and the resources that we have to help all of us navigate this.
Oh, that's great. Well, looks like it's time to wrap up. But Dr. Person, you've been on a number of times before, and this is always a great conversation. I think that you help us understand, the decision-making process, the challenges that the health district sees, and really always give us great examples of how we can all pitch in together to overcome this thing. So thanks for your time this morning. Do you have a closing remark you'd like to make and sign off?
Yeah, I'll just add one other thing, because I when we're talking about as a community kind of coming together to help all of us through this, the other piece we do need to remember is that we have a lot of people in this community that sometimes can't do what they need to do because they don't have what they need. So that's one of the other things that the pandemic has showed us, that we kind of knew was occurring before, that there were people who were challenged, whether by economic circumstance or where they live or where they work. So remembering that we need to be reaching out to them and providing them the support that they need so that we can all be successful at this.
That's a really great point. Well, Dr. Person, thanks for your time today. I did want to say that on Friday we will have the superintendents on Coffee with Karl, so that'll be at 9 o'clock, and look forward to having a great discussion. And I think that'll be the other part of this education discussion that we kicked off today. But the other thing is we don't know yet. The governor yesterday in his order talked about some new funding that would go to help impacted businesses because of this new order. So far, we don't know anything about it, but as we know more, we look forward to sharing that with all of our business partners. And, I guess from the business community, we're all committed to helping our businesses survive. And as we come out of this, hopefully thrive. But Dr. Person, thanks again for your time, and thanks for the discussion. And I'm sure that we will see you again and have an ongoing discussion. But thanks for your time and commitment to our community and the health district. Thank you.